Hi, I'm Dr. Ryan Stratford at the Women's Center. Today I'd like to speak a little bit about vaginal hysterectomy. The term hysterectomy has a lot of connotations, and I commonly have patients ask me, well, doctor, if I'm having my uterus removed, won't that affect my hormones? Won't I feel a lot different? Will it affect sexual function? Those are great questions. To understand why a hysterectomy doesn't have a direct impact on hormone function, I want to show you a diagram. So let's take a look. Looking at this picture, you can see in this diagram where the uterus lies. The uterus is here, and if I pull it up here, you can see where the vagina is in relationship to the uterus. Here's the cervix, the opening for passage of a baby during delivery, and here is the ovaries. The ovaries are up here. They do have a ligament connection, but are not part of the uterus. When a surgeon says he or she is going to perform a hysterectomy, they're referring to removal of the uterus, which includes all of this portion, the cervix, the uterus itself, and usually the fallopian tubes. The ovaries, however, have a different blood supply, and they are not removed unless the surgeon says that surgeon plans on performing a oophorectomy. That term is a Latin term to mean removing the ovaries. So a hysterectomy just includes the uterus itself. Because it only includes the uterus, it doesn't have an impact on hormone function. Most women who have hysterectomies for prolapse have ligament supports that are broken down that make it easy for the uterus to fall down through the vagina. The most effective, least invasive way to remove the uterus in those cases is through the vagina. In this diagram, you can see the surgeons clamp the end of the uterus and is removing it with sequential clamping across the blood supply to the uterus so that it can be removed out through the opening of the vagina. That makes recovery a lot easier. Without having to make a large incision on the abdomen, cutting through muscles and nerves, you don't have to go through as much recovery. The incision's all internal. You can walk around immediately. In fact, most of the time, patients go home the same day of surgery. They're able to manage their pain with PO pain medicines by mouth, and able to walk, able to tolerate food right away, and it makes recovery a lot quicker. Most of the time, we tell patients it'll take 2 to 3 weeks to recover, which is much different than a 4 to 6 week time frame by taking out the uterus through other measures. This type of hysterectomy done through the vagina is considered the least invasive, most effective treatment, particularly for women who have prolapse. We'd love to talk more about this. If you have further questions, come visit me or visit our website at thewomancenter.com.